Jordan, we're going live. So we're actually live right now. So I kind of need you to follow me. Yes, I need you to follow me to the doctor because we are going to do a chiropractic adjustment.
Nice.
Hi everybody, you guys see me in the mirror? Follow me please.
Yeah, paparazzi.
It's going to be 30 minutes. The doctor's over here. Hi, doctor. You guys see, Doc is actually very well. Hi, Annie. How are you? Doc, wave to Annie. Annie is watching you right now as you speak. So, today we are going to show everybody what a chiropractic adjustment is, how it's performed, and Dr. Entwistle here is going to actually explain to us a little bit as to what a chiropractic adjustment really is.
Hi, Annie.
And how much time do we have today? Is this about...
We have about 3 hours if you like, Doc.
Oh, 3 hours. Is that all? Okay.
No, we have 30 minutes. 30 minutes, Doctor.
30 minutes? Okay. We won't even need that long. Yeah. Jordan's already saying that's too long. Okay. Fantastic. Okay. Well, hey. Well, thanks for being here with us today. Really appreciate it. Hi, Annie, and everyone else who's out there. So, what we're talking about today is a chiropractic adjustment. First of all, what is a chiropractic adjustment? Who needs a chiropractic adjustment? How often? And how do we actually do it? What does it look like? Okay? So you're going to see all of that today. So what is a chiropractic adjustment? Well, that's the primary treatment or therapy that a chiropractor does for a patient. What is it? Well, it's a treatment that's designed to get the spine healthy, to take the pressure off the nerves. So if you were looking at a model of the spine, okay, that's a side view. Right, here's the front of the body, here's the back. There's the spine from behind. Okay, so from the side you can see there should be curves. Okay, the neck should curve forward, middle back backwards, lower back forward. Again, from behind, everything should look pretty straight. Okay, right? So what is most important, besides those curves and the straightness in this view, is are those bones moving? Is there proper motion? So problems occur in the spine when instead of the bones moving the way they're supposed to, independently and as a whole in the spine, the bones can get stuck. When they do, they can irritate or pinch these soft nerves. That's a problem for the body because the nerves control everything. The brain sits up here in the head. This is represents the base of the head right back here. When the brain is controlling the body through these nerves, if these nerves get pinched, then wherever those nerves go, well, that's going to change the way that part of the body functions. It could be your muscles, right? It could cause muscle spasm or tightness in those muscles. It could be a nerve that goes to one of your organ systems like your stomach, all right? That can alter the way that stomach functions, maybe producing too much acid, right? Causing some indigestion, gas, reflux, all right? So we have to get the spine moving properly, get the pinching off the nerves if the body's going to be healthy, all right, and function the way we want it to. Well, so what the adjustment does is it helps to correct these areas where the bones are stuck, all right, pinching the nerves. We want to get the bones moving again. That gets the pressure and the pinching off the nerves. It helps to get the tissue that those nerves are controlling healthy again. Plus, it gets the joint surface healthy and the disc, right? By doing that, it also can help prevent arthritis in the future. Super important, okay? Super important. And we can actually see over here, I'm just going to show you what happens when we pinch that nerve. So say, for instance, we pinch a nerve that's up in the neck, okay? Well, by pinching that nerve, we can then feel wherever those nerves happen to go, we can feel irritation, pain, tightness up here in the neck. It could go across the shoulders. We might feel tingling, numbness, burning. It could be sharp, dull, achy. All of that can happen. It just depends on how those nerves are being pressured. And of course, that's just in the neck area. Up a little bit higher, it can go up and cause headaches, okay? Middle back, again, to the muscles, but also organ systems can be involved as well. And it's the same thing as we come right down the spine, finally down into the lower back, okay? Everyone knows about, I've got that sciatica. What is that sciatica, right? Well, it's when the nerves get pinched that feed these large nerves that go right down the back of the legs, okay? And these nerves also, obviously, just like the rest of them that we just looked at, control organ systems, okay? In the case of the lower back, it's like the bowel, the bladder, and the reproductive organs. All right, so a healthy body, okay, means that we have to have healthy nerves, right? Whether it be the voluntary system that we have control over, or what we call the autonomic nervous system. I like to call that the automatic nervous system. Everything that's going on inside of you and I, okay, and everyone else we know, that we don't have to think about, okay? It's all the things that are happening that are kind of on automatic pilot. They're in control, under control of the brain, but yet we don't have any conscious intervention in there. Thank God for that. Don't we have enough to worry about? Okay, so that's what the adjustment does, is it helps to get the spine healthy, taking the pressure and the pinching off the nerves. So how do we do it? Okay, right? And how does a chiropractor find out whether or not you need one? Well, that's why we go through a comprehensive examination. All right, sometimes we'll also follow that up with any necessary x-rays. By the way, we do all of that in-house. We have digital radiography, which is very, very precise and provides a great picture of what's going on inside. Okay? All right, come on over. Let's go back over here to the table. So the adjustment itself, okay, so we find out now whether or not you need an adjustment if you've got pinched nerves in the exam. We determine where, okay, those pinched nerves are, and then we're going to do the adjustment, which is going to help to relieve those areas in the body. So you see we have Jordan laying face down here on the table. This is the position that we like to do the adjustment in. And there are lots of different ways that chiropractors use to adjust the body. Okay, lots of different techniques. The one I prefer, okay, is using a small hand instrument. This is called an activator. And what the activator does is it puts a very quick motion, a very quick force into the body. And by the way, it makes a sound, but it does not hurt, okay? We put the motion into those joints to take the pressure and the pinching off the nerves, okay? All right, so where do we start, okay? Well, when we're looking at the body's like a building, right? Look at us, we stand vertically, okay? So if you were gonna build a building, what's the first thing you put in? Well, it's a foundation, right? You gotta put a good foundation in. A solid foundation means a good structure above it. Well, that's the same thing for us. So what's the foundation to the body? Well, it's our knees, our ankles, and our feet. Okay, so this is where we're always going to start, and then we're going to work our way gradually up the spine from the foundation, knees, ankles, feet, to the hips and pelvis, and then right up the spine, all the way up, right up to the base of the head. Again, we do it very systematically, and utilizing the activator, we go through a very precise process where we know exactly what areas need to be adjusted. We make that correction, and then we can determine whether or not that correction was made fully, and then we move on to the next level. Okay, so we start down here, and we're going to actually be looking at the feet. And what are we looking at? Well, as you can see, there's a difference in the leg length. Okay, now when I talk to patients about that, often they'll say to me, well, doc, hey, I heard everyone's got one leg shorter than the other. Well, you know what? The big man made us a little bit better than that, okay? So that's absolutely not true. What happens is that you could have one leg shorter than the other. It is possible. Say, for instance, you broke your leg and it didn't heal correctly. Well, that can alter your leg length. But most of the time, when we come back, and if you look at the difference here for Jordan, that difference in the leg length there, that's actually a function of, it's called a functional short leg, a function of or being caused by irritation, pinched nerves in her body. So we just need to find out where those areas are, correct them, and that's going to get Jordan's spine realigned and going to get her healthy. Okay? All right, so back to the leg length. We see that her left leg is showing itself to be shorter. You guys can see that. Okay, when we bring it up to and bend her knees a little bit, you can see that that evens out. Okay, so we come back. Where are we going to start? We're going to check the knees first, okay? So I'm going to pull down on the inside of her knee and come back and recheck. Now look, you can see that that is evened out, and the easiest way to look at this is to the black and white right here. That's an easy line for you to follow. If I push back up on the inside of that knee, you can see it brings the distortion right back again, okay? So that tells us that's the first place we need to correct right there. So we're going to take the activator, make the correction, come back and recheck again. Okay, so the legs have evened out. Now remember, when I pushed up on the inside of the knee, it caused it to shorten, but now that we've made the correction, it stays even. Okay, so we're now going to go through the rest of the body to see what we can do that's going to cause the legs to go uneven as we test. So we're really asking Jordan's body, hey, where are the problems? Okay? Ask the body, we're going to get those answers. So we check the outside of her left knee, the outside of the right knee, the inside of the right knee, and everything stayed even down here with her feet, so we know we're good to go up to the pelvis. We're going to push up on the right side of her pelvis. Okay, that brought, okay, see that? It brought the legs uneven again. All right, so that tells us the area we just tested, we need to make a correction, okay? Okay, come back down. Recheck. Now I can retest that if we want to. Push back up on the pelvis, and it should stay even, and it does. So we know we can move to the other side. We test that side of the pelvis. No change there, so we're good to go. Now we're going to start to move up the spine. Okay. So Jordan's is going to make some different moves with her arms, her head, and those are tests for different levels of the spine. Okay, that's going to tell us. So each one corresponds to a level of the spine. If the leg shortens when we test it, we know we need to go to that level and make the correction. Okay, so let's follow along. We're going to work up the spine. We start with L5, which is the lowest movable segment, lowest movable bone or vertebrae that we have in the spine. So Jordan, put your left hand on your lower back for me. Okay, so that caused the leg to shorten. We come back up to L5. We make the correction. Jordan, left hand on your lower back again. I recheck. The legs have evened out, so I know that correction is made fully and I can move on. Hand back down at your side. Okay, right hand on your lower back. That's for L4. Both hands on your lower back. Okay, we have a difference in the leg length. We come up to make that correction for L2. L stands for lumbar, which is what the 5 vertebrae in the lowest part of your back are called. That's the lumbar spine, or the lumbar region of your spine. Okay, now we're going to move on. Okay, Jordan, bring your left arm up next to your head for me. That's it. Good, so that's shortened. So now we're into the thoracic spine. So that's the middle. So there are 12 bones in the middle, 7 up in the neck, and we have those 5 lumbar vertebrae down here. Okay, so this is the lowest of the thoracic or the mid-back vertebrae. Okay, we come back down. All right, the leg length evened out, so we know we're good to move on. Bring your arm back down for me. Good, and turn your head to the left, Jordan. Excellent. Okay, we got a shortening again. We come up. This is for the middle of the thoracic spine, and those all start with a T, right? So this is T6. Okay, we make the correction that corresponds to the rib on the opposite side as well, right? Because all of these vertebrae have pairs of ribs attached to them. Okay. Lift your left shoulder off the table and down. Good. Now shrug your shoulders, Jordan, and down. Okay. Excellent. That's a strange word, isn't it? Shrug?
Yes.
Right? Well, we could have said...
Now, doctor, somebody said, how come you don't crack her back?
Hey, that's a great question, okay? There's lots of ways, as I mentioned earlier, where you can put motion into the joints. I like to use the activator, right? All doctors will pick their preference. The reason I like this the most is because it's so comfortable for the patients, and also, and I'll just use my friend here again. This is Fred, by the way, okay? All right? If I wanted to correct this vertebrae right here, okay? And I wanted to do that by putting a force in with my hand, you can see that I'm going to be covering more than one bone, okay? So often the motion we're going to put in is not just going to affect this one, but its neighbors as well, okay? So I like the activator because I can contact one single bone and make the appropriate correction, all right, without involving any of the neighbors. Okay, I'd rather not disturb the neighbors, but that's me. Okay?
Doc, that's a good explanation. I normally say that you crack eggs, not backs.
Oh, I like that. I like that. It's getting me hungry, too. A nice omelet right now would be nice. Okay? Head back in the center, Jordan. So now we're up now into the cervical spine or the neck. Remember, there are 7 segments up there. Cervical, so everything starts with a C. Okay? Lift your head up, Jordan, and down. Good. So that's shortened. So we come up here to the neck. And again, we can change the motion or the force that we use with the activator based on the part of the body that we're adjusting. Tuck your chin to your chest and back. Excellent. Okay. All right, take a deep breath in, Jordan. And hold it. Good, exhale. All right, fantastic. And if you just come over here, Leslie, and just take a look. So now we end up with two legs that are even, okay, after we've made the appropriate corrections in the spine. Now here's the last question too, right? Well, how long is that going to last? All right, right now Jordan is all perfectly aligned, but she hasn't gotten off the table yet, okay?
Correct.
So is she going to make it like to the doorway? Is she going to make it to the reception area? How about to the curb? Will she make it to the curb, okay? Well, here's the thing, all right? Depending on how long the problem has been there, okay, that's going to determine how long the adjustment is going to last. Obviously, there's more areas to correct the more serious the problem, all right? And it takes us more time to make those corrections, meaning length of care, okay? Depending, of course, on how chronic or how involved that particular challenge is. Now, one of my favorite questions I get, and I love to speak to groups, is, well, you know, I heard once you go to the chiropractor, you have to continue to go to the chiropractor, okay? You have to make like this lifelong commitment, okay? So I like to talk about teeth. I love dentists. I was in dental school before I went to chiropractic school. All right. So here you go. Right. Who out there has teeth? Show of hands. All right. All right. Good. So
Everybody.
that's everybody. Good. Perfect. Okay. All right. So everyone who has teeth knows they should go to the dentist. Right. You know you need a dentist. You have teeth. Okay. Now, we don't all go maybe as much as we should, but you know you should. Right. You know it's important. Okay. So how many years are you going to go to the dentist for? How many?
Nothing. You know.
You mean?
I got some people here saying yes, they all go to the dentist yearly.
Years. Okay. So probably as long as you have your teeth, right?
Correct.
Okay. All right. So, well, that's my recommendation, right? We all have spines, right? Everybody out there have spines? Yes. Show of hands.
Yeah.
Yes. Okay. Fantastic. All right. So my recommendation would be, yeah. Well, if you have a spine, you should get it checked on a regular basis. How often? Depends on what your state of health is. How do we determine that? That's what we do the exam for. That's why we take any necessary x-rays, okay? To determine where you're at, and then we can come up with a plan for you, just like your dentist does, okay? But everybody goes to the dentist, and guess what? If he had to, or she had to, your dentist could replace all of your teeth, right? If you neglected them, they all fell out, they can get you a new dentition or new teeth. Could be dentures or implants. They could do it. The technology exists. What about our spines? Okay, we just get one.
What?
Right?
Are you saying that we can't put that spine
Yeah.
on this body? We can't do that?
I don't think so. At least not yet. Who knows? Okay? Who knows? Things are changing all the time. Right? So if we don't take care of these bodies, where are we going to live? Okay? We typically,
Correct.
the funny thing is we usually take better care of our cars than we do our own bodies. All right, most of us out there, we drive cars, right? You get your oil changed in your car? Yeah, of course you do. Okay? Why do you do that? Right? Is your car making funny noises? Is that why you're going to get the oil changed? You get the tires rotated, you get tune-ups, you check the brakes. Okay?
Yeah.
Why do we do that? Right? Well, we want the cars to last, right? We want them to run well. Right? We want them to, when you turn that key, you want it to start up and boom, you want to go. Okay? Well, if you neglected your car, if you never took care of it, and it broke down, right, and you couldn't fix it, what would you do? Yes, exactly right. You get a new car.
Get a new car.
Exactly. Well, we don't have that luxury when it comes to our bodies. This is it. We get one. Okay? So imagine the car you're driving is the last one you're ever going to get. Okay? That's it. For the rest of your life, you have to drive that car, whatever it is. I know you're thinking, oh my God, that car? Yes, that car. That's the only one you're going to get. What would you do? Would you take even better care of it than you do now? Of course you would. Of course you would. Okay? Because that is the only one. Now, with our bodies, well, this is the only one we're going to get. Okay? So we have to take care of it. Right? It's a gift from the big man upstairs, so let's take care of it. All right? Let's treat it that way. Let's treat it like it's the only one we're ever going to get, because guess what? It is. Really appreciate you joining us today. Please, stay tuned for our next broadcast. We have lots of great information coming to you. Really important stuff like how to brush your teeth. What? Okay, from a chiropractic office? Yes. How to brush your teeth, put your shoes on in the morning, and do lots of stuff without hurting yourself. Very important. Please stay tuned. Thanks for joining us today.